Hello, I'm Dr. Rudy Kasha. So if you're watching this video, then you're possibly considering a thigh lift or coming in to see me for a thigh lift consult. So this is going to give you a bunch of information on that, so it hopefully gives you a foundation for some questions to ask and that sort of thing. So thigh lift, great procedure when applied appropriately. There's different types, and we'll talk about that. It's typically done for someone after they've lost a significant amount of weight. It's not really for a person that has a little bit of that crepiness of the skin or some of the typical things that happen with aging. People think a lot of times, oh, see, if I just pull up on this a little bit, it gets smoother, there's a little irregularities, so I want to do a thigh lift. Never going to be worth it. You're going to have this big scar, and kind of think of it this way. If we sit there and hold up on that, it looks all nice and smooth, but the skin has a natural reflex to want to relax back. It doesn't like to be under tension. So if there's just that little bit of extra skin, a little bit of laxity or loss of integrity is even a better way to say it for that skin, thigh lift will do nothing for you. It'll look like it did the first few weeks because it's swollen, but then after that it'll look just like it did before. So key thing to know is that it's really for people that have lost a substantial amount of weight and have a lot of extra skin there. The negative trade-off with this, which is kind of the case for a certain number of other plastic surgery procedures, is the scar. It's hidden from some degrees, but it's also visible depending on what you're wearing. So there is one type that's totally hidden, so that's the upper inner thigh lift, and that basically stays within your groin crease, basically. So that's all hidden, you won't see that. That's the first type, more of a minimal type of procedure. Then more of an extensive type is the extended inner thigh lift. That goes from kind of the internal midline of your thigh at the groin level all the way past the knee slightly. That's for a substantial amount of extra skin and when it goes down lower. If it's just a little upper skin excess, then we do that upper inner thigh lift, pull and tuck that up a little bit so that that's nice and tight, and then that takes care of everything, usually done with liposuction as well throughout the thigh. Extended inner thigh lift, to go all the way down the inner thigh, take all of that extra skin out, liposuction as well, and shape all of that. Various types of recovery for this, really. It's still a skin-only surgery, so it's not that painful, but especially the longer thigh lift incision, it's more extensive, and there's liposuction that goes all the way around, so it is sore from that standpoint. But otherwise, fairly well tolerated for the recovery. With any surgery, there's risks, so important things to know. So we are working around lymphatics. It's this kind of similar to an arm lift type procedure, but there's lymphatics there that we're very careful to stay away from. But if those were to be injured, you could have some temporary or even long-term or chronic swelling. That's called lymphedema. Not common at all, but it is a risk. There's also sensory nerves where you could have some numbness. Some of that's realistic, that you could have some spots of numbness, but it could be a larger area. And then there's very important nerves and vessels that run through the leg that if those were to be injured, you could obviously have quite devastating issues. Don't expect that at all, but just evaluating the full spectrum of risks that are there, it's important to know that. There's risk of bleeding, there's risk of infection. There is a slightly higher risk in this area of the body where we're operating with this extensive amount of incision that's there, of something called a seroma, that's a fluid collection, or of infection in that area. And that's basically just due to the location that we're operating in. It's not the cleanest areas of our body. We have to do a lot after surgery to keep that clean. But that is something to kind of be aware of from that standpoint, that risk is a little higher than some other procedures from the risk side of standpoint. But there you also get a piece of paper beforehand, a lot of documents and things that'll go through all the extensive full list of this kind of extensive detail. You can read through those. That's just something we need to give you so that you're fully informed. So read through that and ask any questions that you may have on that as well. The scar is important. It's going to be there. It's going to be noticeable. We do everything we can to make it look good, but especially the extended inner thigh lift, that's something to know for a trade-off purpose in that regard. For the surgery itself, we have our own surgery centers. You would have your surgery there. It takes anywhere from about an hour and a half to about 4 hours or so, depending on what type of surgery specifically we're doing. Spend some time in the recovery room, and then you'd go home. You'd come back and see me the next day or 2 days afterwards, and we'll check on everything, make sure you're doing well, and kind of take everything off, show you, look at it, that sort of thing. A lot of times on the thigh lifts, I put this type of glue that stays on for weeks. It just keeps everything cleaner. You'll also go through a protocol of how you keep that area clean that will give you information on that as well. But that just kind of looks like super glue, basically, that you'll see on your leg, and that really seals that incision in well and keeps that clean. But for most people, the recovery standpoint, you're going to have restrictions for 6 weeks. No heavy lifting, no exercising, nothing that could put tension on the areas or create a lot of fluid. We do want you up walking around. We want to reduce the risks of blood clots like DVTs or PEs. We'll give you protocols for that. But we don't want you overdoing anything because that can increase the fluid that can be there. So we want to be careful with that as well. Most people probably a week or two off of work, somewhere in that range. It kind of varies. This is a surgery that's tolerated very differently between different people. So it's something that we kind of take on a person by person standpoint. Typically all done under general anesthesia with a board certified anesthesiologist for the surgery itself. And then we follow up with you as we go along the process and make sure you're doing well. But overall, applied correctly, great surgery. Can totally change that feeling of your inner thighs, how that skin can touch together, how your clothes fit and feel, but in exchange for scars. So that's very important to understand, especially for the extended inner thigh lift. So hopefully that gives you some background on that type of surgery. And if you decide to proceed, if you're already coming in to see me, I look forward to meeting you.